Hello, good morning. Now, today's session is on current medical knowledge focused on anxiety disorders. Now, anxiety disorders, as we have seen earlier, that under ICD it comes under I40 to I48 and enlisted as neurotic, stress related, and somatoform disorders. As a group, we are required to take a bird's eye view of this anxiety. Now, anxiety, if you want to understand, first of all, we have to understand certain basic symptoms of anxiety. In a simplified manner, basic anxiety features are first is first set is autonomic arousal symptoms, palpitation or pounding of heart or accelerated heart rate, that is fast heartbeat, sweating, trembling or shaking, then dry mouth without medication or dehydration. Then symptoms of chest and abdomen are difficulty breathing, then feeling of choking and chest pain and discomfort, nausea or abdominal distress, that is churning in stomach. Then third set here is about brain and mind, or you may say head, feeling dizzy, unsteady, faint or lightheaded, feeling objects are unreal, derealization, or as if I am away from my own self, that is not in my own personality, called depersonalization. Fear of losing control, going crazy or passing out, fear of dying. Then next set is general symptoms. General symptoms is hot flushes or cold chills, both ways. Then numbness or tingling sensation. Next group we see here is symptoms of tension, muscle tension or body pain and ache, restlessness, inability to relax, then feeling keyed up as if tightened up or on the edge, as if I am on the edge and going to fall with mental tension, then a sensation of lump in the throat or difficulty with swallowing. Then next set is non-specific, exaggerated response to minor surprises or being startled, difficulty in concentrating, lack of concentration, mind goes blank, and because of worry or anxiety. And here, persistent irritability, difficulty going to sleep because of worrying. Then, in addition to these 22 symptoms, now these are, if you see in book of physiology, you will find it as under autonomic nervous system, sympathetic nervous system. These are the features of sympathetic nervous system. Then there are systemic. Systemic is GI tract symptoms, abdominal pain, nausea, then feeling bloated or full of gas. Patient will not come to you and say, I have got anxiety. He will come with these symptoms: bad taste in mouth, complaints of vomiting or regurgitation of food, complaints of frequent and loose bowel motions or discharge of fluids from anus. Then cardiovascular symptoms, that is breathlessness without exertion and chest pain. The next is genitourinary, that is GU system, and here it is dysuria or complaints of frequency of micturition, then unpleasant sensation in and around the genitals, then complaints of unusual or copious leukorrhea, vaginal discharge, then skin and pain symptoms, that is complaints of blotches or discoloration of skin, pain in limbs, extremities, joints, then unpleasant numbness or tingling sensation. So in this way, there are 22 symptoms earlier, and these are the 14 symptoms as systemic. In different diagnosis, we will be required to refer to these symptoms. That is why we have chosen to show this here. Now, after symptoms, we go to these diagnoses, these 7 heads. There are many here in these 7. We will focus on about 10 to 11 main features from among these. Now, let us see phobic anxiety disorders. First set, under this, agoraphobia and social phobia. Let us see agoraphobia. The agoraphobia here is, under agoraphobia, there is fear or avoidance. Either fear much plus plus or avoidance don't want to go over there. I want to avoid that. Of what? Either crowd or public place or traveling alone or traveling away from home. Now these are 4 things written. From among these 4 things, it has to be more than one. That is at least 2. If at least 2 are present, then A is present. Second is symptoms more than 2, that is 3 or more from among the basic 14 list. What is that 14 list? I just the same list. I am not going to read it again. This very list. Then from among these more than 2, that is 3 or more of anxiety features with at least one from autonomic arousal. Now autonomic arousal means one of these: palpitation, sweating, trembling or shaking. So from among these at least there has to be one from autonomic arousal. Then C is emotional distress due to avoidance or anxiety symptoms. Either you are avoiding or you are afraid of it. So because of that, there is emotional distress. Mentally he is upset with recognition, knowledge that these are excessive or unreasonable. That means he has insight. He is not a psychotic. He knows that I have got this trouble. He comes and complains to the doctor. Whereas psychotic does not come and complain, others come and complain. So here it is important that there is recognition. The next is symptoms in the feared situations or when even thinking about it. Now what we do simply in aggravation by thinking, we just think of oxalic acid and calcarea phos and these drugs like that. That is alright, one way of thinking. But thinking of that means there is more serious complaint. Complaint is more serious when even the thought of it is is injurious. So here that is D. Then next, in all these we will find exclusion criteria. That means you rule these out. Try to separate them. Otherwise, differential diagnosis we call it in medicine. Here in psychiatry we call it exclusion criteria. What is that? Delusions, hallucinations. If these symptoms are present with delusions and hallucinations, that means it is not agoraphobia. Then organic mental disorders, schizophrenia, affective disorders, obsessive OCD, or not secondary to cultural belief. Maybe that somebody has culturally, he has been taught that no, don't do like this. If you do like this, something will happen. That is, if a cat crosses your way, your work is going to be spoiled. Now, so much fear is there that even thought of cat is injurious. Now, that if it is culturally induced, then that is an exclusion criteria. So, this is agoraphobia. Next, we see is social phobia. Now, in social phobia, marked fear of being focus of attention, because if you go somewhere, people will look at you and you will be focus of attention, or fear of behaving in embarrassing or humiliating way. If I go there, how I will behave if I am required to sit on a table and eat with a spoon and fork, then how I will eat. Everybody has to learn that, no? But then there are people who have got that particular fear, and that is eating or speaking in public. It can be allowed, or encountering known individuals in public, or entering parties, meetings, and classrooms. So this situation is essential for social phobia. Then at least 2 symptoms of anxiety in the feared situation. So like agoraphobia, there has to be at least 2 of those anxiety symptoms. I will not go there again. Then also one of the following symptoms, in addition to these 2, one of the symptoms is to be there blushing, that is face becomes red, fear of vomiting, urgency, or fear of micturition or defecation, going to stool or urine, that I will be required to go. So that fear is number 3. Then we may call it ABC, we may call it 1, 2, 3. Then C or 3 is one of the following sexual. Then among these, what happens by these blushing, etc., etc.? Emotional distress due to avoidance or anxiety symptoms. Because of this, there is emotional distress with recognition that this is excessive or unreasonable, like we found it earlier also. Then symptoms in feared situations or when thinking about them. Exclusion criteria again: delusion, hallucination, organic mental disorder, schizophrenia, affective disorder, OCD, or not secondary to cultural belief, as in agoraphobia. So you have understood two things. One is agoraphobia and second is social phobia. Now these are phobic anxiety disorders, where whatever medicine selection you make, you have to see that essentially these features are covered by your drug largely. Then next is other anxiety disorders. Here we will go through. Here there are specific or isolated phobias also. That is a very long list. There can be fear of lizard, there can be fear of cat, and all those sort of things. That is, if you are interested, you can read it from the books. Now here, panic disorder and GAD, generalized anxiety disorder. Now panic disorder, let us see. First is, it is also called episodic paroxysmal anxiety. Episodic means it comes in episodes. It is not a continuous matter. And paroxysm also means attacks. So it comes in attacks. Recurrent panic attacks. Again and again there are attacks not associated with specific situation or object. That means no particular cause is located, identified. So that is why it is said unpredictable. You never know how it comes and where from it comes. Then attacks not associated with exertion or exposure to dangerous or life-threatening situation. If there is a life-threatening situation and then somebody is afraid, that is not a panic disorder. Then characterized by what? Intense fear or discomfort, abrupt start, reaching a crescendo. Crescendo means height. Reaching a crescendo in minutes, lasting for at least some minutes, maybe 5-10 minutes it may last. Then symptoms more than 3, that is 4 or more of anxiety features with at least one from autonomic arousal. This where it set from among them 3 or more and one of them from these 4. Then exclusion criteria is again physical disorder, organic mental disorder, schizophrenia, affective disorder or somatoform disorder also can produce symptoms like this, but we will not label it as panic disorder. And this particular thing has 2 grades, one is moderate and second is severe grade. Then that completes our panic disorder. Then next is GAD, that is generalized anxiety disorder. Now under generalized anxiety disorder, we find over 6 months of prominent tension. This is relatively chronic stage because more than 6 months. Worry, feelings and apprehension about day-to-day events and problems. So this is a protracted condition and symptoms more than 4 out of these 22 of anxiety features with at least one from autonomic arousal features. Then not meeting criteria for panic disorder. It is not panic disorder because that is an acute stage, different type. Phobic anxiety disorder, no. OCD, no. And hypochondriacal disorder, which we shall see, no. And then exclusion criteria. Actually, these two are relatively comparable, neither this nor this. So that is physical disorder like hyperthyroidism also has similar features. When the TSH is very low and the patient is having a lot of anxiety sort of features and you find that pulse is fast, you get his this profile, thyroid profile, TFT, and find that there is hyperthyroidism, so you have to rule it out. So then not an anxiety, any organic mental disorder, no. Or psychoactive substance related, no intoxication, they also have similar features. Then after generalized anxiety disorder, we go to OCD. Then under this OCD, obsessions means thoughts and compulsions means actions. Thoughts like stickers. See, there is a thinking, then there is an idea, and there is a belief. There is a difference. I may think something. I may think it is wrong to do one thing. Then I may have an idea which is stronger one. Then I may have a belief and I may have an obsession. So you understand that this is a type of thinking which is like a sticker. Obsession and compulsion, doing that thing on most days for at least 2 weeks. It is something that at least last fortnight for most days, that is out of 14 days, more than 10 days, or for most of the days, it must be present. Then obsessions, thoughts, ideas or images, and compulsions with the actions which originate in the mind of the patient. Not somebody who tells and convinces you. Somebody tells you it is good to do like this and you are talking like that. So no, that is under influence. Here it originates from your thought, not imposed from outside person or influences. Then here repetitive, it must be repetitive, doing it again and again and again. Then unpleasant, that is, it must not be comfortable. With minimum one obsession or compulsion excessive and unreasonable. At least one of the obsession and compulsion must be excessive. These are the criteria to make it very sure. Then tries to resist them, doesn't want to do it. Doesn't want to do it. But if long standing, then resistance is minimum. He cannot stop himself. At least one is present as unsuccessfully resisted. There can be other thoughts. I have this thought to do something like this, but I stop myself. That means I am resisting. I have a desire that I must touch every pole, but I don't touch. So that is I am able to resist. Like that, there are number of desires. From among those, one I am not able to resist and I am forced to do that. So that is what is the second criteria. Third is carrying out thought or act is not pleasurable. It is not pleasant. It is not happiness. That is despite temporary relief of tension or anxiety. See, there are some persons who are habituated to do something like this. That must, everything must be underlined. The paper must be very good. It must be duly stapled. It must be straight. Now, if that is a habit which is giving a pleasure, it doesn't come under this definition. But when it affects your entire program, you are missing a train because you are stapling your papers. And unless you staple all your papers, you are not going to catch your train. So that is unpleasant. So that is what is carrying this is not pleasurable. Now, one thing is there. Psychologically, if you say, these are tension relieving activities insofar as Freudian's concept is concerned. There is an anxiety, and by doing that activity, that anxiety is internally relieved. So that is an internal explanation that we are not taking into consideration here. Then obsession for compulsions cause distress, discomfort or interfere with social or individual functioning. Your own program is disturbed, others' program is disturbed because of wasting of time. Because you are required to take bath and at the time of taking bath, you are required to wash your face 100 times. 100 times, 50 times by red soap and 50 times by white soap. Now, if you are required to do that, then naturally you are going to miss. Your others will be waiting for you. There are different types of obsessions. Then, like this, then exclusion criteria is schizophrenia or mood affective disorder. Then next is acute. Let us go to next. Under reaction to severe stress and adjustment disorders, next is acute stress reaction. Here there is post-traumatic stress disorder, PTSD, after injury, and adjustment disorders. So we will focus on these two. Then under acute stress reaction, exposure to exceptional mental or physical stressor. Some cause is there which is exceptionally strong. Then followed by onset of symptoms within 1 hour. And what is that? Mild, it can be labeled as mild, it can be labeled as moderate, and it can be labeled as severe. 3 categories. Mild it is called if anxiety features are 4 or more out of these 22 present, as in GAD. Then it is called moderate when in addition to 2 symptoms, in addition to these 4 symptoms, there are 2 symptoms from A to G. What are A to G? A is withdrawal from expected social interaction. interaction. You don't go there, you don't interact there. Then narrowing of attention, focusing your attention. Apparent disorientation, that is you are not aware of the time, place or other things, you are disoriented. Then anger or verbal aggression, fighting, quarreling. Then despair or hopelessness. Then inappropriate or purposeless overactivity, and finally uncontrollable or excessive grief. Now from among these 6, 3, 4, 5, 6, 7, from among these 7, there has to be at least 2 present in addition to those 4 features. Then you will call it acute stress reaction. Severe when either dissociative stupor. Now what is dissociative stupor? Stupor means sleepiness, and dissociative means you are not able to associate the things. Who is he and where am I? So this sort of dissociation or disorientation, in fact dissociation or anxiety features more than 4 or more plus 4 from these. So either more than 4 anxiety features and 4 from A to G from these 7, or instead of anxiety features there is dissociative stupor. Person is lying now and he is as if after head injury or something like that. What happens? One is stunned, though not unconscious, he is not in his part is sleep, comatose, we call it comatose. So that is severe condition. If a stressor is transient, temporary, symptoms begin to diminish within 8 hours. That means if the cause of this acute stress reaction, stressor, is transient, temporary, then symptoms begin to begin to diminish within 8 hours. But if the stressor continues, if the cause of tension exists, continues, like in aconite and opium, Kent has described in arnica and opium, sorry. In arnica and opium, in arnica he says when the cause continues, it is arnica, and opium when the cause disappears. So that is like that. If the stressor continues, symptoms begin to diminish after less than 48 hours. So that means you have to take into consideration the intensity of the stress. Accordingly, there will be response and result. Then post-traumatic stress disorder. Exposure to threatening or catastrophic stressful event or situation. Catastrophe is a very big event, is a very big episode, either short or long standing, likely to cause pervasive distress in almost everyone. Some near and dear dies, some accident takes place, some unwanted episode takes place, anything you can say like that. Then persistent remembering or reliving by flashbacks. That thing is coming to mind again and again, again and again. Flashback, vivid memories, very clear memories, recurring dreams, getting those dreams again and again. Then circumstances resembling stressor. So that is, these things are persistent. Then next is avoidance of circumstances resembling stressor. If a person with whom he had or she had bad experience had a red dress, then anybody putting on that red dress is causing that. Not present before exposure to stressor, which was not there present before that episode took place. Earlier he was not afraid of red. Then there are two things: either inability to recall, either partially or completely, either full thing is forgotten or partial forgetting some important aspects of the period of exposure to this stressor. Whatever bad event has taken place, whatever stress has taken place, to that some forgetfulness is there, or persistent sensitivity and arousal, that is again getting into that state not present before exposure to stressor, shown by any two of either of these, any clue: difficulty in falling or staying asleep, cannot fall asleep or cannot stay asleep. Then irritability or outburst of anger, that is irritability. Then difficulty in concentration, lack of concentration, mental work is not there, absent mindedness is there. Then hypervigilance, excessive alert, excessive alert, keeping eyes open, and as if anything is happening, he's showing a startling response or exaggerated startled response. Then from among these, any two things have got to be present. Then features B to D, B, C, D occur within 6 months of stressful event. There is a definition that if you are to find out the cause of stress, then there is a no, that thing happened about 3 months back or 4 months back or 5 months back. Yes, it is to be included in that, because up to 6 months the reason, the effect can be there, or end of period of stress, or 6 months after end of period of stress. Period of stress has ended and 6 months back. So that is post PTSD. Then after that, next is dissociative or conversion disorders. Now dissociative or conversion disorders are earlier described as hysteria. This is a list of 10 types. We'll just make a passing reference that there could be dissociative amnesia, forgetting. Then dissociative fugue, does not know who am I, runs somewhere and he goes somewhere, doesn't know where he has come from, and afterwards he comes back and says, I did not remember anything. That is called fugue. This is an anxiety. Remember, this is an anxiety, and this conversion earlier was called hysteria. Hysteric because conversion. Then dissociative stupor, that is sleepiness. Trance or possession disorder, somebody has possessed, taken possession of me, and Amil Mamul like. Then dissociative motor disorders, some paralysis, dissociative motor disorder could be paralysis, hysteria. Then anesthesia, sensory loss. Then many types of this. Then multiple personality disorder like Jekyll and Hyde. In daytime he behaves like something, in nighttime he behaves like something. So that is also anxiety. Remember, it comes under the heading of anxiety and other specific disorders. We'll just make a mention of this. Now here, next is somatoform disorders. Under somatoform disorders, we shall study two. One is somatization disorder and second is hypochondria. Let us see somatization disorder. History of complaints of multiple and variable physical symptoms not explained by any physical disorder for over 2 years. No disease diagnosis has been made for over 2 years, but the person is convinced that he has got a particular disease. Then preoccupation, fixed idea in the mind with symptoms causes persistent distress and leads to seek repeated consultations from this doctor or that doctor. Three or more. Repeated means three or more. That is, maybe that patient goes to all of us, to Joshi, to Kazi, to everybody, to each of one, and that is more than three. There is repeated consultation. Or to local healers, he can go to local healers. So that is called doctor shopping. Then refuse medical advice that no adequate physical cause for symptoms. Doctors are telling that no cause is known. He does not accept it. He refuses. Over 5 out of those 14 symptoms must be present of anxiety. These very 14 symptoms which we have seen here, out of these more than 5 must be present. Not necessarily they may be about the autonomic arousal here, no. But the groups must be at least 2. That is not necessarily the 5 are from only one group. Actually no group contains 5. So naturally it has to be more than 2 groups. So that is what it is. Then exclusion criteria is common exclusion criteria is schizophrenia, mood disorder and panic disorder. The next is hypochondriacal disorder. Hypochondriacal disorder is either persistent belief over 6 months of 2 serious physical diseases, of which one must be specifically named that I have got this particular disease, or persistent preoccupation with presumed deformity. I have got a deformity, I have got this joint is small, or there is a problem in one organ. Then persistent distress or interference with daily living. the earning is affected, seeking medical treatment or investigations. Then refusal to accept that no adequate physical cause, does not accept, refuses that he has got at least somebody can say that you are sick only for 3 4 days. So it is for short period of few weeks sickness is not a continuous sickness. But he or she does not accept this. Exclusion criteria is not recurring, not occurring only during schizophrenic or mood affective disorder. That is apart from these. And after this, there is neurasthenia. In neurasthenia, this is a very old term also. Neurasthenia is written in our ancient homeopathic literature also. Either persistent or distressing complaints of exhaustion after minor mental efforts. Slight type efforts causes great fatigue performing day-to-day tasks. Then feeling of fatigue, bodily weakness. Then next is irritability with one of the feelings of, with any one of feelings of muscular aches and pains, either muscle pain or dizziness or tension headache or sleep disturbance or inability to relax. Then inability to recover from exhaustion or fatigue by normal periods of rest. If I am going for a walk for 1 hour, then after coming from walk, I should relax myself in 10 minutes, or if I am doing extra work one day after journey, after some rest, I should be alright. But that rest period is not sufficient. And here it is a chronic complaint. Remember, duration of the disorder is at least 6 months. So we have seen that in GAD and we have seen that in neurasthenia. Then organic, emotionally labile disorder, post-encephalitic syndrome, that is post attack of encephalitis, then post concussional syndrome, head injury, then mood disorders, panic disorder, and generalized anxiety, that is GAD. And last here is depersonalization, derealization syndrome. Now, what is depersonalization? That is my personality is not there. That is, I am not really here. May complain emotions, feelings, or experience of inner self detached. I am away from myself, strange, not my own, or emotions or movements belong to someone else. These are not my movements, somebody else's movement. So that is personality is away, called depersonalization. Or it could be derealization, that is feeling of unreality. Whatever is happening is not real. This all is artificial. Surroundings of specific objects look strange, distorted, flat, lifeless, uninteresting, or like a strange, or like a stage of acting. I am on a stage. Retention of insight. Insight is there. Patient realizes changes within himself. Realizes changes within himself. Then not imposed from outside by other persons. Nobody has done. Possession syndrome type of feeling is not there. So that is important. Then here there are comments that in organic brain diseases, number one. Number two, intoxication, schizophrenia or mood disorders, anxiety disorders, marked fatigue, hypoglycemia or preceding earlier epileptic seizures. This can occur. So this occurrence can occur along with these things. Occurrence is uncommon in isolation. That means this depersonalization, derealization cannot be an independent diagnosis. This can be an accompanying feature with other conditions. So that is why it is used as a secondary or additional diagnosis. So that is the anxiety, panorama of anxiety disorders. And whatever questions you have,